A new advisory from the U.S. Department of Health and Human Services is raising concerns about the growing impact of screen use on children and adolescents, warning that excessive time spent on phones, tablets, gaming, and social media may be contributing to sleep disruption, anxiety, depression, reduced academic performance, and yes, myopia. The report argues that screen exposure now begins earlier than ever, often before a child's first birthday, and calls for families, schools, communities, and policymakers to take a more active role in setting healthier digital boundaries. Josh, what can you tell us about this report?
Yeah, honestly, the report was amazing, right? I think it's the first time that myopia has gotten the spotlight that it deserves at this scale, right? So the Surgeon General report is really used for urgent public health issues that need national attention now, and there is a whole segment in there about myopia and how screen time is perpetuating that issue. And what I find to be the most interesting is the statistics for how much screen time is really being used by kids at certain ages. So I think it was like 2 years old, they're averaging, about 2 hours already. Toddlers and preteens are getting to 4 hours. And then between 13 to 18 years old, they're averaging 8 hours a day on the screen, which is just
And
insane
that's
for
what
me
they're
to.
telling you about.
Yeah,
Yeah.
making my shoulders hurt listening to that.
Yeah, and
I'm
I
getting
when
a
I was
neck pain
reading
right
this piece,
here.
when I was reading this piece, I felt like a personal attachment to it because I am aging myself in the young way. I was with one of the first classes that they started introducing technology into the school. So we got like the whiteboard that you could write on, we got the laptops, and I was like really in an interesting time because the internet was starting to become more prominent, but we were still going outside, like I played outside and did a lot of that stuff. And so now seeing how much screen time is for kids these days is just crazy to think about. And it's just perpetuating the myopia epidemic, right? So I think in this study too, they said that by 2050, 40% of children are going to be myopic. Well, we know that by 2050, 50% of the population is also going to be myopic. So all signs are just pointing to, the issue getting worse and worse. And I think that they did a really good job of explaining the number one prescription that I know we all know on the podcast, but most people don't think about, which is go outside.
Right.
Right? It's the number one thing you could do. They recommend at least 2 hours outside every single day. It's the number one preventative measure you can take as a child in myopia. So parents should send their kids outside. And I think that it's the easiest thing to do, right? There's no cost barrier to it. It's a fun thing to do. Give yourself a break. The other thing that was really interesting in the study to me was how many other facets of life is it affecting, right? So obviously we're the most tied in myopia and how that affects us. It's our industry, but everything else that revolves around it too, like the physical and metabolic health, educational outcomes, mental health and substance use, like there's just a lot going on with, increased screen use. And so if we can just get people off the screens and get them outside, I think that would really help the issue. One of the things that I wanted to talk about too is, do we think that the school system and the way that things are set up right now, being that things are done so digitally, are school systems prescribing myopia inadvertently? Like, is that a byproduct of what's going on right now? Are we accidentally making kids more myopic by adopting technology in the classroom? I don't know.
What do you guys think?
Yeah.
Andrew?
Oh, Josh, so you nailed it. One hill that I will die on is that everything is connected.
Yeah.
And, eye care is a small part of healthcare. Myopia is a small part of eye care. And so we get siloed into our one little area and we get to thinking that we address the myopia and we don't have to worry about that other stuff. It's all other stuff. It's all related. Everything's connected. And, I was really happy that they included myopia in this because there have been a lot of things that just address the mental health, which is important, or just address the metabolic health, which is important. But it's everything. It's all of this. Maybe you guys, a few years ago, there was a pretty popular book, The Anxious Generation. Jonathan Haidt came out and wrote a really nice book about that. And it expands into every part of life. In our silo, you could prescribe the best ortho-k treatment, textbook, perfect. But if that kid is staying up 3 hours at night with his retainers on, looking at his cell phone at 3 inches, it ain't going to work. Either from a, a clinical standpoint or a progression standpoint. And so uh, that's the number one takeaway that I had. It's all connected. Don't forget that. Address all these things. Every myopia consult should include a talk about lifestyle and hygiene and environment. And I know Cary
Yeah,
has been
amen.
beating this drum for a long time.
Amen, Andrew. Yeah, my newest grandson, there's no these devices. He's now a year old, and he's learning how to play with blocks and 3D, and he's in a 3D world. So keep, behavioral things is huge for your patients. There's nothing that's in writing that says they have to start these devices early on in life. In fact, you don't want to. The American Pediatric Association says plainly they shouldn't even start before 8 years of age, even any contact. So, stay off of these things as long as possible, and you will save them much more than myopia. Their whole lifestyle and how they look at the world will be so totally different. So, yeah, you got it's growing. Such a huge amount of our space is now occupied with this. It's alarming.
Yeah, the grandson he's talking about is my son, and he's a year old, and like the way that my wife and I look at this is that, it isn't just myopia that we're worried about when it comes to his screen time. My wife is nearsighted, so obviously that is very important, and it's very important to me because of the industry and my career and my family being involved in this industry. But the other part of it too is that the way we rationalize it, because we've watched so many other parents use the device as an easy mode to help mitigate the difficulties of parenting. And the way we looked at it was like, let's take this difficult part on for us so that we're not making it more difficult for him in the future with, the effects on mental health, myopia, forming relationships, all of the things that are listed in this report. Let's take that on to be my problem as parents and not his problem in the future. Josh, I want to ask you specifically, is like, I think this is really going to move the needle for the myopia epidemic, but is this going to move the needle for optometrists specifically? What do you think?
I would really hope so. One of the things that I think was an issue is how do I convince or explain to a parent that this is a risk that we need to take action with now, right? Like, why is it a problem that I should take action on now versus later? And I think that for once we have something from, high up that we can give to a parent, right? So if we're explaining, hey, your kid is at risk for myopia, everything is kind of against you right now. There's screens everywhere you go. This is something you can hand them, right? They can go through it. They can read about it. They'll see that 40% of children are going to be myopic by 2050. They'll start to ask more questions and then do more research about why they need to take action now. Whereas before, you kind of didn't really have a bunch of stuff that was easily accessible for them. You could give them a white paper, but not every parent is going to be able to sit through and really digest that. This is a really easy to digest, understandable thing that every parent could walk away with at the end of an exam. So I think that's a great tool for optometrists.
Yeah, for sure. Andrew and Carrie, would you agree with that?
Oh, 100%.
Yeah, it
Go ahead.
is. But the key thing I think, and now that you're building up generations. When I started out with this stuff, it was really the horse and buggy days, but we didn't have it. But now you can see, plainly in your chairs, or you just have to look for these, just observe, and you'll know that this myopia thing, what's happening with it, because the kids are all nearsighted early in life, and their prescriptions are now higher than their parents when they went through a whole lifetime before they encountered this much degree. So just use common sense here. I mean, parents are really looking for you to really steer them correctly, and you got to be I think you should be behavioral oriented. I think you need to really promote good eye health, and that means preventive care. You want to prevent things from getting worse. So I think that you need to make that point clear, and parents will be right on board with it.